Hello, I'm Dr. Brandt Gibson. I'm so excited to be here again today. What I would like to talk to you about is another type of ulceration. So we talked about pressure ulcers, where you get pressure and it creates a interference with the blood flow to the skin, and you actually get a wound or ulceration in the skin. There's a different type called a venous stasis ulceration, where you get chronic inflammation in the tissues, and the tissues get thin and weak. And what happens is you get an ulceration through that skin as the fluid's trying to get out. Why does this happen? Well, a venous stasis is a pooling of the blood in an area. This is typically due to gravity. So it's going to usually happen in the legs and feet, for example. It's typically caused by valves that are malfunctioning. However, if you've got congestive heart failure, where you're getting significantly more fluid retained in the body, you're going to actually get more pulling in the legs as well, more edema and swelling. And when you get that edema, as you get that swelling, what happens is you'll start to get the skin cells and the proteins and so forth in the cells to deposit in the skin. You get a hemosiderin deposit, for example. You get a dark discoloration of the skin gets hard. A little bump can actually cause ulceration. Because of the swelling, you can actually also cause ulceration where because of the pressure, the fluid is trying to get out, ends up going through the skin, and you can get a pretty significant ulceration. I decided not to show pictures today because of how these ulcerations usually look, but they can actually be pretty good size. They're usually superficial, just barely under the skin, because basically what's happening is the fluid's trying to get out, breaks through the skin, and gets an opening that's continues to grow because of the thinness of the skin and the weakness of the skin. Now, the other piece of this is typically they're not painful. They usually don't hurt, even if you have normal sensation. So a venous stasis ulceration is a lot of times just like lots and lots of drainage, and until it gets infected, it's usually just a clear or a sanguinous type drainage. As it gets ulceration, or as it gets infected, it can get worse. It can actually cause a pretty good odor. It can actually start to have pain, start to have significant other types of drainage. So if you have a venous stasis ulcer, so if you have venous stasis disease, you got chronic edema, you're always trying to wear compression stockings, those kind of things, and you're getting an ulceration in that area, a lot of times it could be this venous stasis type. It won't be painful unless it gets infected. If it's painful, that's usually a concern. So what do you do to heal it? The truth is, the best solution is to get the fluid out. You need to decrease that swelling, get the fluid out, and it's going to actually help it heal. A lot of times you'll do compression type dressings where you wrap it in such a way that you're pushing that fluid out of there, or pushing the fluid from the superficial tissue to the deep tissue, so that when you move, when you walk, those kind of things, the muscles can pump the blood back to the heart. Goal here being getting that pressure off the wound so it has time to heal. Because they're superficial, they can actually heal pretty quickly if you can actually solve that process. But you got to make sure there's not infection, or you got to treat the infection. Got to make sure there's not any other injuring factors that's causing the problem, because you want to treat those as well. But if you can get the swelling out, a lot of times you can solve these problems and you can get this wound to heal. It's Dr. Brandt Gibson. This is your Podiatry Tips Day 385. Venous stasis ulceration, which is another type of ulceration that can be problematic, although not painful, can be really hard to get healed if you can't get rid of the swelling. It's Dr. Brandt Gibson. If you have any additional information, or you'd like to look for additional help on this, you can go to utahfootdog.com and we can give you more information. Thank you. Have a great rest of your day.